Hi, Dr. Brill here. I'm recently hearing more and more concern and consternation about doctors not retaining their cash-paying patients. Now, I've kind of been thinking about this. So, what is your brand awareness? What is the brand awareness of patients for your brand? And why are they going to Zenni and to Costco instead of staying in your practice? Yes, I know a lot of people, when they take their RX, they all be back, but we both know that doesn't really happen. So let's say if it's Zenni, they're going there because they know what to expect at Zenni. They're going to expect a $7.95 or $9.95 pair of glasses, or at least that's what they're thinking about. Or Costco. They like going to Costco for all their supplies, but instead, they are going to try to get glasses there, and they think they're probably going to be cheap and maybe be decent quality, kind of like buying paper towels there. But what is your brand, and what do patients know about it? So here's the important thing. We don't generally let people know in advance what to expect in our offices. And maybe you've been cultivating your brand, but to the patients know that you also can do things inexpensively, but yet with high quality. So in my personal office, I always consider what the least risk is and what's the best choice. So in my office, I want people to understand that they're going to get high quality care. They're going to get an optician that really knows about their glasses and knows how to measure them and know that we stand behind them. That's their best choice, least risk. And if somebody's going to Big Box Optical, they are going to think their least risk is really getting a cheaper product and maybe accepting lower quality, but maybe it's good enough. So let's talk a little bit about how are you building your brand, or how have you built your brand? First of all, let's get some tangible things that you can do. And I know this will be theoretical, but have you claimed your Google listing? Do you have photos on your Google listing site or videos? Or can they make appointments on the Google site if your practice management system allows that? So those are key things just to start with. Second, have you ever asked your patients what they like about you, what they like about your office, what they like about your practice? Maybe they're okay with you, but they love their staff. Maybe they love you and they don't like your staff. And everybody by now is surveying their patients, and if not, they're already doing Google reviews. So let's find out from our patients, what are we doing right? What don't they like? Chances are if they like everything, they're going to be back. Chances are if they don't like the office, the experience, the staff, the products you carry, maybe you ought to reconsider how you present yourself to the patients. Third, we all have to demonstrate competence. We want our patients to trust us, but we want them to trust us both for the exams and for the material selections, both contacts and glasses. So, and I think that's where our retention perhaps is not quite as good. Let's make that experience a stellar one. Let's make sure that your website parallels the experience in the office. If it does, you're probably going to retain the patients. Now, if you are in a depressed community and you need to make your eyewear much more economical, you probably have to do that. But be sure that's not the only thing you do. Be sure that you have a selection for people that really like you and want to get upscale eyewear. So it's hard to be everything for everybody, but I think you should have things that people can select if they want to stay with you, instead of saying, I'm only high end or I'm only low end. Okay, so by now, a lot of you are thinking, Dr. Brill hasn't told me a darn thing that I can do, and I want him to tell me what to do, but I just can't. It really depends on your brand, on the cultivated experience you have. Right now, I'm in a real chill coffee shop. I'm noticing the nice lighting, the painting on the walls is cool. There's cars passing by me. It's air conditioned properly. So it's a nice experience. There's not just one thing. So you have to be observant. Perhaps take an afternoon off and think about everything that you do. If you need your staff to help you, I'm sure they'll be able to help you. You actually need someone, a colleague, an advisor, a consultant, somebody to tell you that your baby is ugly and to tell you, okay, look, this is what I think you should do. So concentrate on this, spend a little time, think about the experience, trying to retain your patients, trying to be what they want you to be, and not something else. Be authentic and have your patients trust you and stay with you, and you're really going to have a much better practice and a much better time seeing your patients, and hopefully they'll stay with you too.